I did not realize the number of children were trafficked by family members. And how do we let that child know that this is not normal because it's been normalized in their environment? So when it's the earliest memory you had, as one child told me, I thought that's what every kid did after church. Or I remember my first incident being pictures of me as an infant, or my family, utilizing me and saying they're training me for other men, and that's going to be my job. How do we change that mentality that this is normal for them?
Charrita, can you describe a little bit about some of the work you do within the network and your profession to support survivors of human trafficking?
So, once again, I want to thank you for this opportunity to be able to speak on this topic. This is such an important topic. My name is Dr. Charrita Ernewein. I am a nurse practitioner and I am a professor over at the University of Tampa teaching nursing students. Some of the things that I do in the community is I have focused my education and my networking in the community on human trafficking in vulnerable populations. So for the Free Network, I am the director of community education. So with that role, I'm out doing what we're doing today, educating, but really focusing on educating the community as well as other organizations that we collaborate up with on the topic of human trafficking. Some people think they're aware of it and they really are not aware. So overall, we're really past just awareness, but we still have to remember awareness is integral. It's important, but we're really out there trying to bring all these organizations together. So when we talk about the Free Network, it really started in 2009 as the Community Campaign Against Human Trafficking, Tampa Bay. And they basically, there's an advocacy or a part of that Clearwater Tampa Bay area task force. So when I jumped onto this organization, it was still a part of that. And then it started to change and evolve. So there are numerous organizations out there in the community working to help victims of human trafficking in the Tampa Bay area. But that's where the campaign against human trafficking of the original community, they were able to organize and bring all of these organizations together so that we were in a room creating one of the largest human trafficking organizations at that time. It later became Free Network, and that's kind of where we are now. So all started there with that, 2009.
Excellent. And can you tell me a little bit about some of the organizations and the types of organizations and partners you have in the free network?
We partner with the local law enforcement. We partner with the Pasco organizations in regards to law enforcement. We partner with the welfare system, Metropolitan Ministries, the others, Suncoast Union. So we're bringing all these organizations together. We partner with other non-governmental organizations, NGOs such as Homes for Survivors and Victims, Sail Freedom, One Child. So these are all organizations that we are partnering with in the community to bring everyone together in the room. We're also partnering with local schools, bringing education into that atmosphere also.
Excellent. Can you talk a little bit about why it's so important to bring multidisciplinary groups together? Why it's so important to have this collaboration effort in addressing human trafficking services?
Yes. Now, one of the things that we encounter all the time in the arena of human trafficking or this area is that multiple organizations are all trying to get the same funding or sometimes overlapping in the services that they provide. And it actually decreases their ability to be able to complete a task because we're all kind of fighting for the same task. With the free network, that's not what we're doing. We're not an actual service organization. So we're bringing these organizations that we just talked about together. When we bring them together, this is where when they work together, one example being myself, I'm working with Brent Woody, which is a legal organization, and we're working together to help with some of the victims of human trafficking, probably victims from the back page, and we're doing interviews. So we're kind of collaborating together to help them get the resources and the tools that they need. And that's kind of what we're looking at. When we come together in the room, we can identify, okay, who needs housing? Now, who's offering housing? Who needs psych mental health? Who's offering these services? Who needs just overall help, legal representation? We're able to get updates from the legislative team, our political parties that we work closely with, as well as the law enforcement. So it's really important that we have this collaboration in the room so that we can just meet the overall needs because our goal is to be holistic. What are the identified needs? It's not just the here and now as to this person needs a home, but this person may need a home. They may need to get their records expunged. They may need continued medical support. We are really trying to get everyone in the room to meet all of the needs of these survivors. We also want to look at prevention. How do we prevent? Prevention is essential to protecting the community from future targets and the victims of slavery or human trafficking. So we're committed to providing ongoing education in the community, but we're trying not to overlap with the other parties. Back to that collaboration. Who's doing what and what can we do to help this whole fight against human trafficking?
Excellent. Yeah, it sounds like you're like trying to find where the gaps are and finding who you have in your existing network to either fill that gap or places that gap can be filled.
Absolutely. That goes back to some of those grassroots in regard to what our mission and our goals are, our strategic objectives, is to find that gap, to identify that gap. And you're thinking, oh, well, one big thing that we would really love and need to have is just a resource list. These resources that I mentioned, and there's a long list, even though I only mentioned a few, that the resources that we can offer to someone in that moment. Then it becomes a problem of keeping it updated because if Laura wanted to call somebody, you want to call someone that's relevant. You don't want to call 20 people to say, sorry, I don't do that anymore. So really important that we continue with this collaboration so that we can do that at any point and help have that information available.
Perfect. The Florida Institute for Child Welfare has a network of community providers in the child welfare space, partners with DCF, child welfare oriented researchers, things like that. What are some of the things that you'd like our network to know about the free network?
One of the things that I would love for the network to know about the free network is that we're here. So we actually meet twice a month. So if you have any identified needs, you're like, oh my gosh, we really aren't reaching these people in the community, then the free network, we have this list of, 100 plus organizations that we partner with. We're going to help get them in the room so that we can help you get what you need. And we won't know what your organization is lacking until we have you in that room so that we can bring these partners together. And some of these partners, they need what you have. So recognizing that that goes back to exactly what we do is getting all groups in alignment and with current needs or upcoming activities or information. And the best way to do that is to get them in the room. We do that with that twice a month meeting, but we also have a quarterly in-person meeting. So if we were to collaborate with you guys, being able to see what do you need, let me bring all of these organizations to you so that we can be effective because we know that with human trafficking, a lot of it's happening with our kids in the foster care system. Who do we educate? How do we bring these people together so that we can be proactive and prevent this from happening?
Thank you so much. Can you talk about some of the biggest wins that either the network or you have had relating to helping this population?
Absolutely. So I'll start a little bit about myself and then the free network and then some of the things that you've seen just with some of the big busts that we've been having recently. So I went back to school and got my DMP, my doctoral nurse practitioner, and my PhD on human trafficking from UCF with a PhD, and that focused on reintegration into the community, which is what we're talking about now. So I was able to interview over 30 survivors of human trafficking to identify what were their needs as they exited human trafficking and reintegrated in the community. And what we're trying to pull together really reinforces that research that I had completed regarding their needs. They need financial support. They need legal support in regards to getting records expunged. Many were trafficked as children. So that goes back to us talking about the foster care system. What put that person at risk and how do we educate to prevent that? And then recognizing that a lot of their needs are long term. So when we get housing, it's not just for a moment. This need is for years potentially as they learn how to do things, how to get a trade, how to get a job. So that was kind of my personal experience. But when I did my research, it identified that healthcare providers, which I'm a nurse practitioner, that we failed the survivors. And most of them said we did not ask the right question. We did not do an assessment, that we actually labeled them and fell into that, oh, it's just a prostitute type of mentality. So one of my personal wins is that annually I probably teach 12 times a year, at least going out to educate doctors, nurse practitioners, nurses, physician assistants, pretty much any office staff. So we're doing that education regarding what does this victim look like and what do we need to provide them as they start to recover. Because recidivism, that return to trafficking is high. So we have to be patient. We have to take care of ourselves, knowing that we may see this person another 5, 6, 7 times before they're actually ready to exit. So that's been some of my personal wins as I've been able to get into those rooms and really educate healthcare providers because the lack of knowledge is really there. Now, as the free network, they gave me that platform to be able to do some of that, but it also helped me to go to my next stepping stone, which is Shared Hope International. I am the chairperson for the board of directors for Shared Hope International, and we are getting out that information, what human trafficking is, childhood trafficking, and how big it really is. So Linda Smith, the founder of Shared Hope International, we're actively engaged in the community. We're the state report cards. So we're behind that in regards to states being graded and what they're doing, their activities on human trafficking. One of the biggest things that we are currently doing is we're looking in the jails and the prisons to see which children were arrested from trafficking and are they in jail still? What do we need to do to look at their records? Because should children be in adult jails from trafficking? Many times the child or the victim was actually prosecuted versus the trafficker, as we know. So big things we've done is we have really filled the rooms, bringing these organizations together. We have a network that we can call and say, hey, we would like to do this event. So we're going to bring all of these organizations that we just talked about together so that we can start collaborating as to what do we want to do for 2026. We are going to provide a survivors luncheon so that we can support the survivors. And when we go there, we're going to invite all the organizations that we talked about in regard to law enforcement, legal team, and just overall anyone who's out there helping and doing something in the community.
And now you talked about when you were talking about your personal experiences and kind of the mentality that you're helping train against or help train to change. Can you talk a little bit more about this, "Oh, they're just a prostitute" mentality? Can you talk about how that plays out, what the impact that is, things just high level kind of explore that concept?
Absolutely. So many of the survivors I was able to interview were treated poorly, were identified as drug addicts or prostitute. So just a little bit about the research so that you know, and I'll just take that in just a minute. With doing these interviews for the survivors, the big things that came out is how poorly they were treated. That poor treatment by being treated in the hospital, identified as a prostitute, that kept them from going back and being treated. That kept them from getting the health care that they needed. So when they went back 10, 15 years later, they were really sick. Many already suffer from comorbidities, which is, multiple health conditions from not getting treated. But now it's worse because we were treated so poorly that we don't trust the system that we're not going back. They called the police on me. The police arrested me. I went to jail. They took away my children, or I'm just really sick. And they're not asking. They don't understand that I can't follow what they want me to do. So lots of negativism associated with it. So my goal is to change that view. And we're doing that. But also the survivors, they came in contact with some nurses or healthcare providers that they thought were good, but the majority of the experiences were bad, leading to worse health outcomes, unfortunately.
Thank you for sharing that. I think that that stigma, that stigmatization piece is such a piece that's so important in our work that we help dismantle that and continue to help dismantle that. So,
Absolutely. When you talk to a survivor, they're going to say in the room, they always feel that. That's not something that you completely overcome. So if they're triggered by whatever reaction or someone's reaction, then it may send them down a rabbit hole. And no, we can't avoid all triggers because we don't know what the triggers are, but we can and use trauma informed care. And that's what I teach. I teach over at the university, like I said. So I do teach the nurse practitioner and the nursing students on human trafficking, that trauma informed approach. And then what does that survivor need in that moment versus what do you think you need? So how can we help them?
perfect. You've talked a lot about this already, but is there anything else you'd like to share about the ways you've seen the impact of human trafficking on youth, families, communities, things like that?
The internet crimes against children. That's huge. How do we get this education to the families and to the kids? So even when I'm talking about it to my nursing students, they have kids and they're like, oh, they don't get it that the person, this trafficker, is not necessarily in a white van driving down the street. They're in your home from this game that the kid is playing, your child is playing. And they are allowing them to go, or, then they ask them to go into a different room and now they have a child. So, how do we educate more on the internet crimes against children? But we also need to collaborate as we're doing it and preventing childhood trafficking, because those adverse childhood experiences lead to some of the trafficking for our kids. And those adverse experiences include child abuse, families that were addicted to drugs, incarcerated family members. These overall list of things that happen to this child is decreasing their ability to stay out of these victimizing situations. So they're more actively a victim. So when we go back to it with the welfare system, are we truly educated? And I don't know the inside of, what's going on in our systems. I know that a lot of times as healthcare providers, we're overworked. So we're not able to see what's going on. So are we truly educated that this is really a thing versus kids coming from overseas? Yes, kids are coming from overseas, but many are being trafficked right here in the United States. And one of the things I learned through my experiences, and I've been out here for a while, over 15 years, I did not realize the number of children were trafficked by family members. So my research uncovered that over 50% of children are trafficked. Familial trafficking is a thing. So educating on familial trafficking so that we know what to look for. What do we do with it when we find it? And how do we let that child know that this is not normal because it's been normalized in their environment? So we try to find that peer support, even at the adult level, those survivors of trafficking. We find that peer support. Who can be a mentor for them? Who's gone through it? Because the person who's gone through it, who's mentoring this other child, is really going to be a positive impact on their success. How can they actually look and see that there is indeed a way out? Recognizing that they don't know anything different, though. That's hard when you're trying to teach something to someone. So when it's the earliest memory you had, as one child told me, or adult told me, I thought that's what every kid did after church. Or I remember my first incident being pictures of me as an infant, or my family, utilizing me and saying they're training me for other men, and that's the job, that's going to be my job. How do we change that mentality that this is normal for them? But I think mentorship is going to be huge. In the schools over the years, we've had some mentorship programs where students are going around educating other students on human trafficking. Unfortunately, it's very sensitive right now in regard to the schools. So I feel like that's a limitation. I was a nurse in the school district, a nurse and then a nurse practitioner for over 15 years. So as I'm bringing this information back, I see it not going in the community. I learned that there's a human trafficking task force in the school district, but it doesn't involve nursing or healthcare providers. How can you have a human trafficking task force that does not include healthcare providers when where do you think the kids are going? To the nurse, right? So I still feel like there's this gap in regard to that there's this separation. So there are a task force in some of the schools or the education department, but what is that task force doing? Who's providing education? Who's being educated? We're still number three because we are, that destination state. This is where people are being brought to be trafficked. I worked with a survivor who was trafficked from her family members, but she went to high school every day. She went to school. So they're right here in the community. They're not always on the streets. We're just not seeing them. In regards to other places, I'm going to say at least Florida, they're one of the few states that have mandatory training for human trafficking. So healthcare providers do have mandatory training. Law enforcement has training. They have some of the better grades than other places as they do try. I think that the environment is changing slightly, so it's being redirected. So we're not getting as so much support on human trafficking, but we did have one of the law enforcement guys say, well, we're being redirected to internet crimes against children. So I'm trying to integrate that term into everything we do because now we're going to get law enforcement back at the table. They'll still be paid or directed that they can go to these events because it's focusing on internet crimes against children. Well, what are internet crimes against children? That includes human trafficking. So we're able to tie it all together and still have these key people in the room with us. So yes, we're a hub. We have a large number of strip clubs. We have agencies and churches that go out to these strip clubs. We have the destination states because we have big events happening. So it's well hidden right here in front of us in Florida. But we do have some things in place to help combat human trafficking.
Well, I think my last question I always like to leave off with is there anything else you want us to know? Anything else you want to share before we wrap up?
I think you let me have the floor to talk on lots of things, including, the incarceration of trafficking survivors that potentially are still incarcerated. That's one thing that we at Shared Hope are actually investigating. We're working with states to see how can we get into their jail systems, their records, so that we can see who's been incarcerated and potentially help them get out of the trafficking situation. And then how do we get these kids protected? How do we get this education? What resources do we have to be able to get them educated and prevent this from happening to them? So really directing the resources appropriately for protecting our kids.
Well, thank you so much for taking the time to come and talk with us. I really appreciate it.
Thank you, Lauren.
If you're interested in learning more about this episode and our guests, please visit our website at ficw.fsu.edu. Thanks to our producer, Dave Heller, and thanks to all of you for tuning in. I'm Lauren Harrod for the Florida Institute for Child Welfare.